Here are the top 5 exercises that I do with my patients after a flexor tendon injury and that you can do as well. My name is Huang. I'm an occupational therapist and certified hand therapist, and I can tell you right now, flexor tendon injuries are some of the worst hand injuries that anyone could have. And if you're going through this, I'm really sorry. I know it must be so frustrating. It can be so depressing, and there can be so much confusion around what to do, what to expect. So check out the video I did on the 5 ways to get the best and fastest recovery because I make some really important recommendations there. But I know that a lot of people come to YouTube and want to know what can I do on my own. And now the with flexor tendon injuries, it really what you're allowed to do depends on how many weeks you are out of surgery, right? Depends on how many weeks out of surgery you are. So what you do at week number 1 and number 2 is completely different than what you do at week 6 and week 8, right? So based on where you are in your journey, talk to your therapist about what you can do. The 5 exercises I'm going to show you are exercises way um, past the sensitive stage, right? Past the let's be careful stage, because you do want to be careful. You don't want to do anything that's going to rupture the tendon repair. If you've had what's called digital nerve repair because you cut the little nerves on the side of your finger, you can't do anything at the very beginning, the first 2 weeks of that repair. So these exercises are when you're safe to do everything. And if you're not sure, please go talk to your certified hand therapist first to make sure that these are safe. These are the 5 exercises I like to teach my patients, and I like to make sure that they're doing them and they're doing them right. So number 1, first and foremost, swelling is a really huge concern for anyone who has a hand injury. And swelling goes away very slowly, very slowly. At first, when you're really puffy, that amount of swelling goes away fast, but the residual swelling that remains there and it keeps coming and going, and it's like, why, I can't put my ring on. It still feels so tight and so swollen. That swelling takes a really long time. You might not see it gone until like 6, 9, 12 months after your surgery, right? After your surgery. So it does take a while, but what you're looking for are small incremental improvements, little bit by little bit by little bit. And then one day you're going to notice, I don't have any swelling. But it does take a long time. So if you're worried about swelling, please don't worry so much about it. Just know that as you move, the movement is what's going to help the swelling the most. The movement is what's going to help the scarring the most, right? So first and foremost, the massaging. So you can massage from the top down for swelling, from the top down. And your finger is really skinny, really small. And so when you massage from the top down, make sure you can move all throughout the finger, right? All throughout the finger. Don't just focus on one spot or one spot. You want to move through the whole thing. And then what happens is a lot of times we have these structures in our big knuckles, right? And I always describe them like little buckets. And these little buckets, they hold that water in. So one of the best things that I like to teach my patients is just to slide their fingers in and rest in between, because the thickness of your fingers can stretch out between the bones. This is a bone, this is a bone. And when you put your fingers in between, it stretches those ligaments there, and it just helps to stretch. And what I call is like, if you stretch them out, you dump out the water, right? So stretch out those ligaments and dump out the water. So you're like emptying those buckets. So just sitting like this is actually really helpful for swelling, believe it or not. And it's so simple that sometimes people are like, it's too easy, but it works. So those are the two things that you can do for swelling. So that's one of my top exercises. As you get the swelling down and you just work on that a little bit, it's going to help you feel like, I'm getting somewhere and I want to be able to do more. Number two, the most important thing is also scar massage. So we often think about the scar. So if you have a flexor tendon, you might have the scar right here, on the top of your fingers. So a lot of times people sit here and they just massage it like this, right? So I encourage you, you can massage it up, you can massage it down, which direction feels really good for you, right? But scars don't just work in one-dimensional ways. Once you have swelling, you have a little bit of scarring throughout your finger, and it's not just where the surgeon made the incisions. You have it all around. That's why your finger feels so tight as you move. So you can massage all of the skin. You see, if I come a little close, you can see when I move my skin side to side, my skin moves. And if your skin's not moving that way, it just might be stuck, right? So one way to do it is, yes, you can massage up and down, but I would also encourage you to massage rolling it. So you see how I can hold my skin and then I can move my hand in one direction, right? And that way you can massage the scar in one direction and then also in the other direction. Find the direction that feels the best and go into that direction first, right? And then move into the other direction because scars need movement. So, yes, there's tons of creams and people are like with the silicone gels, all that is handy dandy. Um, they're great superficially, but understand that your scar is deep inside. And one of the best ways to move scar is through movement. It's through movement that we essentially realign the fibers that scar is created by, right? And so you want to take it and you want to rotate it. So you can just rotate it like this. You do this very often throughout the day. And you don't have to be super aggressive, you can just roll it and move it, right? Just roll it and moving. And those are the two best things that you could do. Um, Number three, the other exercise I like to do is it's extremely important to get full passive range of motion. Full passive range of motion. If you don't have full passive range of motion, meaning you can push your knuckle all the way down and you can straighten it all the way up. If you don't have full passive range of motion, then your tendons, your muscles can't move fully. So let's say your muscles get long and they get short, right? Those tendons move. But if your joint is really stiff, then you can only move this much. Just reducing it by 70, just reducing it by 25% really can cut out what is possible for you. So if this is how much you can move, let me see in the screen. If this is how much you can move, you want to be able to move all that way. If your joint is stuck and you're only moving this much, see, you're going to lack and you're going to continue to have pain. You're going to continue to have stiffness. Your scar will still be really tight. So I always say this for myself. If I, knock on wood, as a certified hand therapist, injured my hands in any way, I would want full passive range of motion. If I want this for myself, why wouldn't I want to teach this to my patients? So this is what I teach, if you are, someone with a hand injury and you're in Miami, Florida, I'm talking to you from my clinic, hands-on therapy services. This is exactly what I tell my patients. I teach online through Hand Therapy Secrets to other occupational therapists and certified hand therapists. This is exactly what I tell them as well. So if you don't have full passive range motion, what can you do to go get full passive range motion? So look at my knuckle. Your knuckle might not move as much as my knuckle moves. You just want to have as much movement as your knuckle moves. So my knuckle can go what is called hyperextension. It goes beyond zero, right? So if I cut my finger, I would want to get as much of that as possible so that I can feel like my joint gets loose, right? So I would want full passive range of motion here, and then I would want to bend it all the way down, right? And again, when it comes to flexor tendon injuries, you have to know what phase and stage you're in to be allowed to do that. In certain instances, there's where you're not allowed to really go into full passive extension, and that's usually when you have a digital nerve repair. But at the very beginning, right at the very beginning of right after surgery, so find out where you are and when you're allowed to do this. But if you're, you know, a minimum of 4 to 6 weeks out, you're allowed for the most part. So you want to stretch and get as much passive range of motion as possible in every single joint. And then you want it all together, right? You want to get full passive, right? So I like to bend here. I'll show you on my small knuckle. I like to stretch it all the way out like this. So I put pressure on my little middle knuckle and I pull it all the way straight. And then I like to bend it all the way in here and here, and then I like to tuck it in, right? That's full passive range of motion. What was that? Edema, so massaging for your swelling, scar massage, massaging for your scar, passive range of motion for getting your joints fully. Okay, the fourth exercise I want to show you, they're called, it's one type of tendon glide exercise. It's where you're getting your tendons to glide. So one of the best ways I like to do is, again, I like to put my fingers in between. This is how I teach my patients. Put in between. Key thing is to keep your big knuckles straight. And then you're going to curl your little knuckles down. And then you're going to go up. A lot of times people just focus on going down, but going up is extremely important because as far back as you can go, this is what's going to help stretch those flexor tendons, right? And then because you stretch them out, they also has a capacity to pull all the way down, right? So don't just work here. Like a lot of times, one of the biggest mistakes I see, I'll share with you, is that everyone works in the middle. And middle is comfortable, but you want to work at end ranges. So you want to curl it all the way down, be really intentional with your exercise, and all the way up. Slide them all the way out, curl them all the way down, and then all the way out, right? So that is an exercise. It's probably one of my favorite exercises. So the fifth one is you can combine them. So this is called a hook fist, and then you come into what's called a full fist, and then this is a straight fist. Again, one of the biggest mistakes that I see that my patients do, because they just can't help themselves, to be honest, is that you're trying so hard. So you squeeze too hard, like you squeeze your fingers too hard. But what you really want to do is do it in a gentle way where only the tendons are working. And then I say drop it like it's hot. So you don't have to like be so forceful, is because this is the most important part, to glide the tendon. And you just drop it like it's hot, because these are the little muscles inside your hand that help to pull the big knuckles down. And then this is I would say the fifth exercise that's most important. It's called a straight fist. And the reason why the straight fist and the hook fist are so important is because they get the tendons to glide separately, right? So you have two tendons that make up the ability to move your finger. One is the superficialis that come to bend your middle knuckle, and then the profundus is the one that bends your little knuckle. And so what happens is when you do a hook fist and you do it well, it gets one tendon gliding separately from the other. And then when you can do a straight fist, it will focus on this superficialis and moving it separately from the other. So this is why they're called tendon glide exercise, because it's specifically moving and gliding those tendons. So number four is hook fist, and number 5 is straight fist. If you can get those, then you'll be able to tuck it all the way in and not have a gap and have a really full fist. And the main goal here is, you see this crease in your hand, right? This crease, when you bend your big knuckle, that is called your distal palmar crease. Your distal palmar crease is where you want your fingertips to tuck in. And ladies, this might not be really popular during this time where people love to have nice nails and fake nails. But for the specific nature of a flexor tendon injury, for the specific nature of a flexor tendon injury, cut your nails. You want to cut your nails short so that you can able to tuck it in because you want to be able to slide it all the way and tuck it into that little crease. And then once you recover fully from your flexor tendon injury, you can grow your nails out. You can get fake nails as long as you want. But during this phase, during this recovery from a flexor tendon injury, the last thing you want to do is have anything that's going to block your ability to get full range of motion, full function of your hand. And when you once you get that and you get rid of the pain and you reduce the risk of having a second surgery because all your tendons got stuck together and scarred down, after you fully recovered, then you can do whatever, long nails. But anytime I get a patient that comes into my clinic and they have long nails, for a hand and flexor tendon injury, I don't make them. I ask, hey, for your best benefit, it might behoove you to cut those nails short so you can get the full range. And then once you fully recover, you can do whatever the hell you want. So anyway, those are my top 5 exercises after a flexor tendon injury. I hope this has helped you. I really highly recommend you find a trusted certified hand therapist in your area. If they're not certified hand therapists, just work with someone who has a lot of experience working with flexor injuries. Flexor tendon injuries are some of the worst hand injuries. They can become very debilitating. They sometimes require, secondary surgeries if not done correctly. Um, so work with someone that you trust. And if you are not sure, I highly encourage getting a second opinion. Why not? It's your hand, it's your life. And if you're someone who's looking for a second opinion, my name is Huang. I am located in Miami, Florida, with hands-on therapy services, and I'll include the links below. So if you're looking for a second opinion, you're looking to come in first and foremost, so you don't need a second opinion, you can find me here at Hands-On Therapy Services with myself and my team. So I hope this video has helped you. If it has, please like and leave me a comment. Let me know if this is something that has been helpful. All right, thanks. Bye.